A primary gravitar effort for vaginal bleeding in the first trimester, and what we see here is there is a gestational sac seen. Now this is the gestational sac. With viable fetal pole. This is the gestational sac, the chorion, double decidual reaction or trophoblastic reaction. This is the fetal pole. We do see cardiac flicker. Positive waveform. Here you can see. Here. So any rough idea of waveform to show you that it is viable and intact gestational sac of 7 weeks. This is a magnified view. Now to normal. Now there is a gestational sac which is, this is the gestational sac which is near the os. Here you see. This one, cervix, os. This is gestational sac number 1. And now there is another gestational sac. You see these are the twin pregnancy, early twin pregnancy. This is gestational sac number 2. This one, gestational sac number 2, fetal pole and residual reaction or trophoblastic reaction intact. Here, if I magnify, you will see a yolk sac. This is the yolk sac. Measures 2.3. Above you see this is the fetal pole. You will see the cardiac activity is present. Cardiac flicker is easily visible. So fetal pole is seen. There are 2 gestational sacs, early pregnancy of 7 weeks with intact gestational sacs with the fetal pole cardiac activity seen in both. Now, in between these 2 sacs, we see an area of crescent-shaped transvalencies around the gestational sac number 2 in the this is the gestational sac and this is the crescentic shaped transvalency. In between the 2 gestational sacs, if I can show you both together. Okay, part of the gestational sac number 1, part of the gestational sac number 2, and in between this area is showing is multi-septated. Multiple septations are seen. You see, these are all septas between this sac and between the other sac. This sac. This is the area. Now this is in fact bleed or fluid with echoes and with few tiny septas, which is hemorrhage, you can say, yes, with between the chorion. This is the chorion of the sac number 1, and here is the chorion of the sac number 2, and this collection is within the bounded scene between the chorion as well, and it extends to the surface of the uterus, uterine wall. This is the uterine wall. So this is the uterine wall. From here you see this all fluid collection with internal septas and echoes, and this is between these two sacs, and so between the chorion and between the and between the uterine margin, this one, anterior uterine wall, this is a subchorionic bleed, and this indicates this may be a bleed from the area of the future development of the placenta in this region. Now this finding is consistent between consistent with the subchorionic bleed in early twin pregnancy of 7 weeks. Now we have to see that what is the size of this bleed, which will define the prognosis of this particular patient. So let's see the sac, compare it with, let's see the sac and the size. This is the sac, and this is the bleed here. So it's almost the size of the gestational sac. You see, this is the slightly bigger than, it's more than 50%, I think. Yes, if I take this as a reference value, then the bleed is about more than 60% that of the size of the gestational sac. No, this is the size of the this is the size of the this bleed. It is 37 mm into 31 mm, and the size of the sac is 22 into 25. So it's more than 50%. So it will come in the category of severe form or of the hemorrhage. More than 60% is considered to be severe. So this is this has a poor prognosis when it's more than 50%, 60%, 50%, or when it is 60, maximum 66% is the limit, upper limit. But this is something around more than 50%, or you can say 50 to 60% is the bleed compared to the size of the gestational sac. So future depends. Prognosis, keeping in view the present scenario, is a little grim in this case under study. So this is our case of the day, which is that of a twin pregnancy with subchorionic bleed. This is the. Thank you very much.